To East Africa now, Uganda is recruiting women to participate in a trial of an injectable antiretroviral drug to replace Truvada, a daily pill that has a low adherence by its users. Now, the trial now in its third phase will assess if the new drug, Cabotegravir, is safe and can further reduce the risk of acquiring HIV. Alima Thumani has more from Kampala.
Ugandan sex worker Hajira Bate knows to put her health and her life ahead of money and to reject clients who refuse to wear condoms. But even for those who are careful, like Bate, contracting HIV, the virus that causes AIDS, is a high risk.
We had many issues with condoms because sometimes condoms burst, and sometimes because of the nature of the work we do and the dangers of the work we do, sometimes we can see, sometimes there are incidences and scenarios where sex workers are raped.
To reduce the risk of AIDS, Uganda last year launched the daily use HIV prevention pill Truvada. Uganda's Ministry of Health says there are 8,400 people using Truvada, including sex workers. The pill is up to 90% effective, but only if users can get past the stigma and maintain the routine of taking it every day.
If women do not take this pill regularly, compared to men, they are not able to retain most of the Truvada in their body. So it's very important that you give them options.
The option Uganda has put to trial is the injectable drug Cabotegravir, which only has to be taken every 2 months. 3,200 women in Botswana, Kenya, Malawi, Swaziland, South Africa, Uganda and Zimbabwe are in the third phase of the drug's clinical trial. Dr. Joshua Msinguzi is Program Director for the Uganda Health Ministry's AIDS Control Program.
We hope it will be successful, because then there you will be able to have a stronger protection, because you'll have removed the challenges around adherence. And that maybe in the long run you'll get stronger programs. But as of now, we are still using the oral daily tablets, but for high-risk populations.
The hope is that the less frequent need to take the drug will make it easier to prevent the spread of HIV, especially for those groups at highest risk. Halima Athmani for VOA News, Kampala.